A man in his 50s walks into a doctor's office, but he is not there for usual problems like high blood pressure, chest pain, or an enlarged prostate. He is there for something else, something he struggles to even say out loud. But after a long silence, he quietly says, "Doctor, something is not working." Doctor immediately understands what he means, but he calmly replied, "Be open with me, I am your doctor." The man looks down and finally says, "My private. They are not working anymore." And that moment, what sounds like a private and uncomfortable issue becomes something much easier. Because for many men, even bringing this into conversation is a huge step. After a detailed discussion about the history of his erectile dysfunction, its quality, and many more detailed questions, something caught the doctor's attention. The man has a long history of poorly controlled diabetes, and men with diabetes are about 3 to 4 times as likely to develop erectile dysfunction compared to men with no diabetes. Sometimes it can be one of the earliest warning signs that diabetes is already damaging blood vessels and nerves throughout the body, including the genitals. And that's true for many men. Erectile dysfunction isn't just about sex, especially in older adults. Sometimes the problem is vascular, the blood vessels supplying the genitals become damaged and narrowed. Sometimes it is nerve damage, where years of diabetes neuropathy slowly damages the nerves required for arousal and erection. And sometimes it is hormonal, because diabetes also affects testosterone level and the body's hormonal balance. When most people hear the word diabetes, they think about sugar. But diabetes is not just a sugar problem, it is a slow systemic disease that quietly damages blood vessels, nerves, and hormones throughout the entire body. The eyes, the kidneys, the heart, the brain, and yes, even the incredibly delicate system required for an erection. That's why men with diabetes are about 3 to 4 times more likely to develop erectile dysfunction compared to men without diabetes. And it doesn't happen only later in life or for long-standing diabetes. Sometimes it happens much earlier than expected. In fact, studies show that more than half of men with diabetes will experience some degree of erectile dysfunction during their lifetime. That might not be always a complete loss of erection. Sometimes the changes are subtle at first. A man who once had a firm and reliable erection may notice that they don't feel as strong anymore. Maybe the erection doesn't last as long as it used to. Maybe intimacy becomes inconsistent. At first, many men blame stress, aging, or fatigue. But in reality, the body may already be showing early signs of blood vessels and nerve damage caused by diabetes. But why does this happen? To understand that, you need to understand one important idea. An erection is not just about sexual desire. It is a vascular event, a neurological event, and a hormonal event, all working together in perfect coordination to achieve and maintain an erection. First, sexual desire has to be present. Sexual stimulation, whether visual, physical, smell, emotion, or even sexual thoughts, activate the brain. The brain then sends nerve signals down the spinal cord to the penis. Blood vessels relaxes and blood flow rapidly increases. And finally, an erection happens. Think of penis like a balloon. When a balloon fills with air, it expands and becomes firm. The penis works in somewhat similar way, except instead of air, it fills with the blood. We put a lot of time and effort into scripting, recording, and editing these videos, but our channel is still pretty small. If this type of content helps you even a little, give that like button a gentle hit and subscribe. It really helps us. Thank you. And diabetes can interfere with almost every step of this process. First, diabetes can affect the mental health and the brain. When people are diagnosed with diabetes, they immediately think, this is the end of the world, I can never eat sugar anymore, I am gonna go blind, my life is ruined. But that's not true. While diabetes currently have no permanent cure, it is very controllable. And hundreds of millions of people are already living normal and joyful lives with diabetes. And this matters because anxiety, chronic stress, and depression are some of the biggest enemies of sexual function. When the brain is under constant stress, sexual arousal becomes much harder. So, yes, diabetes is not good, but it is not the end of the world either. Then there's blood vessels. Over time, high blood sugar damages the delicate inner lining of the blood vessels called endothelium. Excessive glucose triggers formation of harmful molecules called free radicals, creating something known as oxidative stress. This oxidative stress injures blood vessels and reduces the production of nitric oxide, one of the most important chemicals needed for erection. Nitric oxide is what tells blood vessels in the penis to relax and widen, so more blood can flow in. Without enough nitric oxide, the blood flow becomes weaker and erection becomes more difficult to achieve or maintain. At the same time, oxidative stress can also increase increase inflammatory chemicals inside the blood vessels, causing even more damage over time, little by little, day by day. And without proper blood flow, the penis remains like a flaccid balloon that never fully fills or becomes firm. And this problem doesn't happen alone. Erectile dysfunction in people with diabetes commonly occur alongside other cardiovascular risk factors like high blood pressure, abnormal cholesterol level, obesity, and metabolic syndrome. And in many cases, this condition worsen each other over time. What is important to understand is that the process happening inside the penis is actually very similar to what's happening during a heart attack in the heart and a stroke in the brain. The same atherosclerotic plaques that narrow blood vessels in the heart and the brain can also narrow arteries supplying the penis. But here is the crucial difference. The arteries in the penis are much smaller. Penile arteries are only about 1 to 2 millimeters wide, while the coronary arteries of the heart are around 3 to 4 millimeters, and some major arteries supplying the brain can be even larger, 7 to 8 millimeters. That means even a relatively small amount of plaque buildup can reduce blood flow in the penis much earlier than it would in the heart or the brain. In other words, the penile arteries often become affected first. And this is why erectile dysfunction can sometimes appear years before a heart attack or stroke ever happen, often about 2 to 5 years earlier. So, when a patient with long-standing diabetes and other cardiovascular risk factors says, "Doctor, I have erectile dysfunction," what they might actually saying is, "My blood vessels are already in trouble." And I'm not telling you this to scare you, I am telling you because erectile dysfunction, especially in someone with diabetes, should never be ignored. Sometimes it can be an early warning sign that the body is already developing serious vascular disease, and paying attention to it early may help prevent further complications like heart attack or stroke. Then come the nerves. Diabetes can damage the nerves, a condition called diabetic neuropathy, and erections depend heavily on precise nerve signals traveling from the brain and spinal cords to the blood vessels and tissues of the penis. When those signals become weak, delayed, or disrupted, the system simply cannot respond the way it should. Most people have heard about diabetic neuropathy affecting the feet, and even you might have seen people with diabetic foot ulcers, numbness, burning pain, or even leg amputation caused by long-standing diabetes. But what many people don't realize is that the same disease damaging the nerves in the feet can also damage the nerves involving in sexual function. And this image shows it very clearly. This is a healthy nerve where signals travel smoothly and efficiently. And this is a nerve damaged by diabetic neuropathy. The axon is the long cable-like part of the nerve cells that carry electrical signal from one part of the body to another. When high blood sugar damages these axons, nerve signals become weaker and slower. As a result, the communication between the brain, nerves, blood vessels, and the penis start to break down, making an erection more difficult to achieve or maintain. And then come hormones. Testosterone plays a major role in sexual desire, energy, mood, and erectile function. But in many men with type 2 diabetes, especially those with obesity, testosterone levels begin to fall. And once that happens, a vicious cycle can begin. Low testosterone can worsen insulin resistance, while insulin resistance can further reduce testosterone level, so the cycle keeps feeding itself over and over again. And diabetes, especially type 2 diabetes, rarely come alone. It usually brings friends with it: high blood pressure, abnormal cholesterol levels, obesity, sleep apnea, depression, and chronic inflammation. Each one quietly adds more stress to the body, and each one increases the risk of erectile dysfunction, often making it more severe over time. Sometimes even medication used to treat these conditions can contribute to problems. For example, certain antidepressants called SSRIs, commonly used for depression and anxiety, are well known to sometimes cause sexual side effects, including erectile dysfunction and reduced libido. Some blood pressure medication can also contribute, especially older beta blockers such as metoprolol, atenolol, and propranolol. But interestingly, not all blood pressure medication worsen erection. Some may actually improve erectile function by improving blood vessels health and blood flow. Examples include medications like losartan and nebivolol, which may have a more favorable effect on erectile function in some patients. That's why treatment is not just about prescribing pills for blood pressure, depression, or erectile dysfunction. It's about understanding the entire picture: the blood vessels, the nerves, the hormones, mental health, lifestyle, medication, and the underlying cardiovascular risk hiding beneath the surface. Because if you catch the problem early, you may not just improve a symptom, you might prevent something far more dangerous like heart attack and stroke from happening. And yes, erectile dysfunction can be frustrating, uncomfortable, and sometimes deeply embarrassing. But sometimes it can be also an important warning sign before something far more serious can happen. So, what can be done? This is where the story starts to shift from fear to control, from hesitation to taking action, and from frustration to becoming healthier not just sexually but overall. Because unlike many other complications of diabetes, erectile dysfunction is often treatable, and in some cases it can even improve significantly or partially reversed. And it starts with the basics, the cliché things people often ignore: lifestyle changes, weight loss, exercise, better sleep, quitting smoking, and improving blood sugar control. Because they are not just general health tips, they directly improve blood flow, hormonal balance, inflammation, and nerve function. In fact, one well-known study found that overweight men who lost weight through diet and exercise significantly improved their erectile function compared to those who did not. Researchers believe that improvement happens because weight loss reduces inflammation, improves blood vessels function, and increases insulin sensitivity. Even modest weight loss can sometimes make a big difference. Then come medications. You have probably heard drugs like sildenafil, commonly known as Viagra, tadalafil, also known as Cialis, and vardenafil, known as Levitra. These medications work mainly by improving blood flow to the penis. They can work very well for about 60% of patients, but they do not work for everyone, especially when diabetes has already caused severe nerve and blood vessels damage. Interestingly, some studies suggest that vardenafil may work slightly better in certain men with diabetes-related erectile dysfunction compared to sildenafil in a specific situation, although the response varies from person to person. And treatment doesn't stop there. Some diabetes medications such as metformin may indirectly improve blood vessels health and insulin sensitivity, which can improve overall vascular function. Other diabetes medications are also being studied for their effect on blood vessels, inflammation, and sexual health. Researchers are also exploring the emerging therapies that target completely different biological pathways to improve erectile dysfunction from multiple angles, but we will discuss them in another video. In some cases, hormonal therapy may be considered, but there is not a one-size-fits-all solution. And if all other options fail, surgical options may be considered. And finally, there is something many people overlook completely: the psychological side. Sexual function is not purely physical. Stress, anxiety, relationship problem, poor self-esteem, and depression can all strongly affect erection. While psychological causes of erectile dysfunction are often more common in younger people, for example men under 40, where stress and anxiety may play a larger role. But in diabetes, mental health still matters enormously because depression is almost twice as common in people with diabetes compared to general population. And this creates another vicious cycle. Diabetes worsens erectile dysfunction worsens mental health, and poor mental health make both conditions worse. Breaking that cycle is just as important as any medication or lifestyle changes. Sometimes people simply need to hear this. Diabetes is not the end of the world. Today, hundreds of millions of people live with diabetes, and many live normal, active, fulfilling lives with proper treatment and some lifestyle adjustments. So when you look at the full picture, erectile dysfunction in diabetes is not just a complication. It is a window into blood vessels health, hormonal balance, nerve function, and even mental well-being. And maybe the most important message there is, this is not something to ignore, and it is not something to feel ashamed of. It is something to pay attention to, because sometimes the body whispers through erectile dysfunction before it screams with heart attack or stroke. And for many men, erectile dysfunction is that whisper. And if you are interested, we made another video discussing food that may naturally support erectile function and vascular health, and this video is this. So if you are interested, check this video out.